there are important elements at the core of Obamacare that are flat out unconstitutional. And even if they weren't unconstitutional, they would be unwise because they're a dramatic expansion of the power and role and authority of the federal government. The most obvious is an absolute mandate in the bill, a mandate from your federal government that every man, woman, and child in the United States must buy health insurance. Now, this is unprecedented. There's never been a mandate like that from the federal government or any level of government. There's never been this forced purchasing of a product in the private marketplace. So this absolute mandate that every man, woman, and child in the United States go out and purchase health insurance, purchase a product in the private marketplace, is unprecedented, and for that reason it is unconstitutional, and it's an unprecedented expansion of the power and role and authority of the federal government. In the last few days there have been hearings, quite late to the hour, but there have been hearings in the Senate in committees about the constitutionality or unconstitutionality of Obamacare. Of course, this central question came up. I found the response of some of the witnesses at the hearings who favored Obamacare, who were advocates for Obamacare, pretty startling on this point. One senator in the committee asked them, well, if we can mandate constitutionally that every American man, woman, and child buy health insurance, why can't we pass a law that says obesity is a real problem in this country, which it is, and therefore we're going to mandate that every man, woman, and child in America eat certain vegetables and certain healthy foods every day. Do you know what the response was from this advocate of Obamacare? Well, I don't think you can mandate that they eat the food. You can only mandate that they buy the food. Great. Reassuring. To me, that's not an argument for the constitutionality of Obamacare. That's a clear argument for the unconstitutionality and danger of the Obamacare federal power overreach. That's why we demand repeal. That's why we will continue to pursue repeal until it happens, and that's why we will replace this huge, burdensome bill with targeted reforms, like protecting folks with pre-existing conditions, like reimportation, generics reform, and other measures to reduce prescription drug prices, like allowing American citizens to shop for health insurance across state lines and to pool together through their small businesses, through other means, through association health plans. Thank you, Madam Chair. With that, I urge all of my colleagues to come together. Let's repeal this really problematic plan, and let's start anew with focused, targeted reforms that the American people have been asking for.